Hello, my name is Nikhil Vasdev and I'm a consultant urological surgeon and clinical senior lecturer in urology at the Hertfordshire and Bedfordshire Urological Cancer Centre at the Lister Hospital, Stevenage, UK. I'm very grateful for the BJUI to have selected my recent comment published in the March edition of 2019's BJUI titled Whether the Robot Has a Role in Radical Cystectomy to be the article of the week. This paper has been co-authored by Pramit Khetrapal and Professor John Kelly from University College Hospital, London, and Professor Jim Catto from the University of Sheffield. We looked at current controversies around robotic cystectomy in our comment, which highlighted the fact that in the UK, between 2014 and 2015, approximately 3,700 cystectomies were performed. 25% of these were robotic only, whereas during the same time frame, if you look at prostatectomy, 80% of prostatectomies that were performed were robotic. Controversies around open and robotic cystectomy continue. Literature highlights that there is an advantage of open cystectomy being less expensive, whereas with robotic cystectomy, current evidence indicates lower blood loss and possible quicker perioperative recovery. The RAZOR clinical trial was published by Professor Dipin Parekh in 2018, which again highlighted very important questions. In this excellent publication, there was more and more data which came through highlighting the fact that in robotic cystectomy, blood loss was significantly lower and so were transfusion rates, whereas the operative times were slightly longer. In the RAZOR clinical trial, the robotic reconstruction was extracorporeal in most cases, as what we can tell from the publication. There was no accepted definition for surgical experience in robotic cystectomy. The RAZOR clinical trial included surgeons who had done 10 robotic cystectomies, whereas the Pasadena consensus highlights that approximately 30 cases are needed to get over the learning curve of the procedure. The oncological equivalence of both techniques was similar. In the UK at the moment, we have the IROC clinical trial running, which is a phase 3 multi-center randomized control trial between robotic cystectomy with robotic urinary diversion and open cystectomy with open reconstruction. I think this trial will crucially answer the real benefits of robotic cystectomy in due course, which is being led by Professor John Kelly and Professor Jim Catto, who are both authors on this paper. And hopefully, with more and more data maturing, we will be able to highlight the real benefits of robotic cystectomy with robotic urinary diversion in comparison to open cystectomy and open urinary diversion, not only from the perspective of perioperative and postoperative outcomes, but also from the oncological status. So this publication will hopefully help clarify whether the robot generally does have a role in current clinical practice with robotic cystectomy.